topic of discussion for today is education and health, and we know how important that is to the average Nigerian. In fact, all Nigerians. We've been having lots of discussion, and every day we hear that when there is a plane crash, of course, there is always hoopro. Everybody, the whole country will be grounded because we all feel the pain. We feel the pang that maybe 100, 200 of our citizens, families, and friends die. But how many people die every day from health related diseases? We are the second largest contributor to infant mortality in the world. The same for maternal mortality. Preventable diseases such as malaria, treatable diseases, diarrhea, HIV keeps killing people at every point in time. Beyond that, education is also a very big issue for us. Nigerians are the greatest wherever we are. We are very proud people. And all the professionals, even when you look at drain, even in the health system, they say we contribute the largest number of health personnel everywhere. If you are in the UK, you are bound to be attended to and you are giving birth by at least a Nigerian nurse amongst the personnel. But what is happening to our education system? 10.5 million children out of school in this same Nigeria. Beyond the 10.5 million children out of school, every year the standard of education keeps dwindling. These are part of the issues we are putting before the political parties to debate and tell us what their master plans are on. Not just what they have in their manifesto per se, but how they hope to implement this when they get into office.
We are looking at two very critical sectors in Nigeria, and those sectors are health and education. Will we begin with the health sector? Your two parties are running for the office of president, members of National Assembly, governors at state level, members of state houses of assembly at every level. What will be your party's blueprint for reviving Nigeria's health sector?
The major plan of the APC is to focus on prevention. We believe that it is cheaper to prevent people from falling sick than allowing them to fall sick. And one of the most common diseases in Nigeria is diarrhea. Ordinarily developing a culture of hand washing, like we did during the Ebola virus, can cut away exposure to a very large extent on diarrhea. Now, if you look at the current structure, about 70% of our health spending is concentrated in the urban areas. But the majority of the people who don't have access to healthcare services are in the rural areas, people who are poor, people who cannot pay. Now, the APC strategy is to ensure that the current very limited coverage of 3.5% in the health insurance is broadened to cover people in the informal sector, of course, working with the state government. So the focus is one, prevention. The second one is expand health insurance to cover the informal sector and ensure that people no longer have to dig their hands into their pocket to pay them they fall sick. The third approach is how do we need to re-examine the entire process of training our medical personnel. For example, does this country know today how many gynecologists that we need? Do we know how many ophthalmologists we need? Do we know how many pediatricians we need? These are the difficult work that need to be done. How do we train them? Majority of our training, our officers, doctors still do their training abroad. They don't even have the opportunity. Only yesterday, the PTP government announced that it's banned overseas training. And this includes medical doctors.
Our country was attacked by Ebola virus. And you notice we became the first country in the sub-region to actually bring that down because the Ebola was a direct attack on the public health delivery system. That tells you that Nigeria's public health delivery system is robust. As I speak to you right now, our country is polio-free. For the past 6 months, no new cases of polio has occurred in Nigeria, and that is why we have achieved that status of being declared polio-free. We are doing quite a lot of things. Our intentions is the new investments in the health sector will not only provide jobs, but also dissuade Nigerians from traveling abroad for whatever you call it. As we provide the new health facilities that we need all across the country, so will Nigerians not only gain jobs, but also continue to do more to train themselves here, and that money that will be spent abroad for medical tourism will be spent locally. We have done very well in the health sector.
You must be aware that Nigeria is clearly off the mark, off the track in meeting the MDG targets for maternal, newborn, and child health for 2015. As a country, indices continue to be unacceptably poor. Nigeria's current scorecard for under 5 mortality stands at 128 per 1,000 per bed, far away from the MDG 4 target of 70 deaths per 1,000 live beds. And while the maternal mortality ratio is currently 576 deaths per 100,000 live beds, away from an MDG target of 250 deaths per 100,000 live beds. Now, what will your government do to bring hope to the Nigerian mother and child if you are elected to pilot the affairs of Nigeria?
The health sector already has a 5-year plan, which is all encompassing. And this is not outside the MDG target and equally the national target. I am afraid I don't know where the statistics is coming from, but taking the statistics of 2008 and 2013, 545 over 1,000, now 350. That is what is on ground.
These statistics are coming from the World Health Organization.
That's
the authority in that area.
Okay, we're speaking about our national health here, and our own statistics. We should be able to trust on it. And at the same time, I want to remind us that the health sector in this country has made considerable achievement towards MDG target of 2015 in the area of child mortality rate. Yes. It has so dropped, more than 50% drop from where we are in 2012. And 82%, for instance, in 2013 is the record we have regarding under 5 mortality. So these are the records on ground. So I would like to use this opportunity to remind us that we need no reminiscence where we are like 10 years back, as if that is where we are right now. The health sector is making tremendous achievement to give Nigeria the best health environment that we can ever dream of.
See, like my colleague said, we believe it is cheaper to prevent diseases rather than to treat them. And we also recognize the fact that only 3% of our people are covered by any form of health insurance. So we are having a health, program which is based primarily on making sure that nobody travels more than 5 kilometers before he or she can have free health services or drugs. We are going to build our healthcare system on providing more midwives, providing more community health workers. We're going back to the old days where we are going to have dispensaries and clinics, mobile clinics and mobile dispensaries. Now, certain things are important for health, and two are very important. One is access to potable water. The other is the environment within which you live. Now, without access to potable water, and without every Nigerian being able to live in a very clean environment, you find it difficult to prevent even disease.
How will your party address the problem of incessant industrial actions.
The medical doctors that were going on strike were not just simply asking for more money, as we made to believe that it's about more salaries or more allowance. It goes beyond that. Of course, that's an important issue.
Yeah.
But from what I've seen, it is clear that what they are also demanding is a total restructuring of the entire health system architecture in the country in a way that will allow for optimal utilization of capacities.
Absolutely.
And make them feel fulfilled that they are serving people. You need to go to some hospitals in this country. On the condition, you see the conditions under which doctors work. And I think call duty allowance now is maybe 5,000 naira or something. You see, so, and when we have the biggest challenge of sending doctors to the rural areas, then you will know that you have to look at this issue of incentives. But how do we prevent it? Prevention is to ensure that agreements reached are honored. When people sit down with government to negotiate, they must have the faith, they must have the confidence that whatever they agree to will be respected by government and all the parties involved. So I think that's the most important way. There will continue to be issues there because we are talking about processes, but the most important way the APC government is not going to sack health workers because they've gone on strike at a point where we are facing a very serious public health challenge. So that is what the APC government intends to do. But more importantly, if you realize that we have about 10,000 Nigerian medical doctors in the US alone, and about 3,000 in the UK, then you ask yourself, how many doctors do we have left in Nigeria and where are they? So these are the biggest challenge. We don't even have these statistics. So the work we need to do goes beyond throwing money around and say you are building hospitals. You need to build hospitals, but the systems, that is where the work is.
Industrial strikes alone in the past 5 years are responsible for the upswing in our recurrent expenditure. Those industrial strikes, some of them demanding money, actually caused a 55% increase in the recurrent expenditure of the country. That's why today it's so difficult. We have about 75%. And of course, you cannot stop people agitating for a better life. So it goes beyond the politics that you have the medical professionals fighting against the medical services providers, which we know, and which of course we don't try to get in, but try to give proper advice to the National Assembly to treat the doctors as the head of whatever medical institution that you have. But what you have, as you have seen the argument to Ray John, it's actually a carryover from the past, the days of dictatorship, where some people wangle that and suddenly put some other people over medical doctors. I believe in every hospital that the medical doctors should head, and that's why we're also working to provide for a Surgeon General of the Federation.
You all will attest to this, that gender inequality are the fueling agent of HIV and AIDS epidemics in Nigeria. So how will your party, PDP or APC?
That's coming to you.
Hello?
Gender, how do you
Go ahead.
So how will your party, if in power, uphold gender equality, number one, then protect women and children and girls against child marriage, forced marriage, arranged marriages, inheritance and inequality between sex?
There's already a national policy on gender addressing all those inequalities. But for the benefit of today's discourse, let me just get down to the issue of gender and HIV/AIDS that you talked about. Apart from being a woman, you also know that the issue of gender, the issue of HIV/AIDS in our health sector is already improved. As a few days ago, the president signed into law the Discriminatory Act. So female are all part of that. If there's any HIV/AIDS woman now, you're no longer going to be discriminated in terms of employment, in terms of having your social life ahead of you.
So you also know that the PDP in government has done a lot in the area of reducing transfer of HIV/AIDS from mother to child. You are aware of that. The percentage rose up to about 70% according to the statistics. So, and the PDP is seeking the 5th mandate now to make sure that in the next dispensation, before it finishes, HIV/AIDS would have dropped to at least 2% in our health sector.
You see, the honest truth is that we have today too many ineffective agencies coordinating our health matter, and that is why we're where we are. It will interest you to know that the entire spending of federal government on health is only 5%. This we intend to raise in the next 4 years to 10%, and in the next,